I'm Talia Michelle with Autism One up close and personal today with Dr. Jin from the Brain Treatment Center in Newport Beach, California. They also have several locations internationally. Dr. Jin's treatment is magnetic resonance therapy.
Correct.
Can you tell us a little bit about what that is?
Magnetic resonance therapy is a combination of traditional transcranial magnetic stimulation combining with a electrophysiology measurement we call EEG and ECG, and everybody knows the ECG. So by combining them, then we individually customize the stimulation package of the TMS system. So that I will go on with that when the question.
So stimulating the TMS system. What is the TMS system?
TMS is a large electromagnetic stimulator that currently used for major depression. They use that strong magnetic pulsing to stimulate your brain by releasing certain neurochemicals, and then assuming they will normalize your chemical balance, and then or ended up with the effective treatment for depression.
So how does that translate to autism?
Yeah, now in autism we found that patients behave that way. It has its own reason. And for example, you see patients withdraw. They don't want to have eye contact with you. Mm-hmm. And most of the time I think because I look ugly. But later you found that kids actually are very smart. Mm-hmm. They avoid eye contact. In that case, they can effectively cut down about 70% of information intake. So the idea is that when we get into their brain calculation, because we record their brain waves and record their glucose metabolism or blood flow, you will see their brain is overly bombarded by information or noise. So that
they can't filter.
You cannot filter anymore. So the best way to do this is by cutting down the information intake.
And you can do this with the magnetic resonance therapy.
What we're doing here is that not just helping them to cut down information, we help them to normalize the brain so that they can handle more information.
So does the therapy look the same for all children?
No different. That's why we call this customized magnetic resonance therapy treatment.
So when you're doing the EEG and you're gathering information, can you tell if someone's brain is perhaps more severely affected than another?
Not just the severity. Like you and I, we have all different type of brain waves, and somebody has a much faster wave, the other one has a much complex patterns, and the other one has two slow waves, so that every individual has a different waves, and then we have a very large database based on their age and gender, so that for every individual comes in, we take your wave to compare with the mean of your peer, and we can look at the z-score, which is a standard deviation away from their mean. If it's significantly deviate from the mean, we know you have a trouble with either too much this way or too much that way. So that what we are doing here is very simple. We use your intact brain waves and then convert that wave into a computer language to drive the large machine to stimulate the area that has been affected.
So you're stimulating the area that's affected, and you're sort of turning it back on?
Turning it back on by synchronizing with the healthy part of the brain.
That is so fascinating.
I know, it's very visible. It's in front of you. And we found that 90% of a chance you can see clearly what's wrong, because we have a very nice three-dimensional mapping. You can rotate the map in high resolution.
So you can actually target
the
section of
the
the
area.
brain.
Absolutely.
Stimulate that section.
That's right.
And so what are the results that you're getting?
The results I'm going to present it tomorrow in the keynote speaker. And recently we finished a double-blind study in 28 cases, 14 of them in placebo, the 14 of them in active treatment. And now we found that not just significantly different between the two groups, we found that more than 50% of kids after treatment, after 5 weeks of treatment, they become neurotypical.
5 weeks of
5
treatment,
weeks
50% of the kids. And the other 50%?
Significantly improved, but still not to the level we like.
But a significant improvement is huge.
What I call the significant, for example, you take CAR score. CAR score is a very common rating scales for severity. My significance measure is based on 30% improvement on CAR score. Using that percentage, I would say in this group is more than 70% of them responded. because we still haven't finished the final analysis yet, but our rough intake is about 70%.
So are we saying that 70% of the 50 that don't fully recover, we're seeing that kind of dramatic improvement?
That's right. You've never seen this kind of things in any other therapies.
Why wouldn't a child improve? So the other 30 of that 50?
That's the very critical things. Now we realize that autism is not, as everybody believes, it's a single disease.
Right.
It's a very broad spectrum.
Yes.
And it's a converging behavior which can be caused by so many different type of underlying problem. For example, you have a Crohn's disease. If your GI fighting against me, and I just stimulate your brain, I will not win the game.
And there is so much connection between the
guts and brain.
So maybe the more a family works on these other issues, healing the gut,
yeah, absolutely.
Or
these are all important. And the other important things, for example, these days, kids don't stay outdoor anymore. And we found that lack of sunlight can significantly affect your circadian rhythm.
And this is a vitamin D issue?
No, it's a circadian rhythm directly related to your clock genes.
Okay.
And now the effective treatment will not just be the magnetic stimulation, because we cannot win the battle if you don't sleep, and your wave in the morning will be very slow. And now at the same time I want to push up the high frequency, and then you don't have enough energy to join me, so half of the brain stay in the low frequency, I cannot win. So that our next step will be like this, not just treating the brain itself, we will also encourage people to take their kids outdoor, to take enough sunlight in the morning, so that it can absorb those blue light around 450 nanometer in wavelength, which will significantly reset the phase of your clock genes. So those are the things that we think is very, very important.
Fascinating. Now, is there work that parents have to do to prepare for coming in and doing MRT?
No, at this time we don't, because our protocols are very simple. We know that not everybody will respond exactly the same way, so that kids will have to come in, we test them out. First of all, we need to look at their EEG. If your EEG, your brainwave look exactly the same as normal, and I have nothing to treat, it must be something else. So we found like a small percentage, 5 or less % of our kids in their normal EEG wave, and then we can't do anything. And then we will try out for 4 days. If that 4 days you didn't see any change, then we will not do anything, because we expect very visible change in 4 days. That change will include EEG and also behavior. Mother and father will be able to tell the difference.
Wow, amazing, in 4 days.
4 days, okay. So after that 4 days, we have to reach 3-way agreement that as a patient, as a parent, you have to see the change.
Sure.
But after that, if you see the change, I don't think you're objective enough, because parents always use a microscope to look into their kids. So I have to have my contract physician, who has no financial interest in this, to validate your finding is clinically relevant.
Right. So now you've got the anecdotal evidence
and
also
you've got the physicians, the professional backup, and then my EEG measurement, second EEG, has to validate your change is correlated with my EEG measure.
Fascinating. Now
if it's not, then I don't do that.
When you're saying EEG, is it the typical EEG that one would get with a neurologist?
It's a typical measure, but calculation is different, totally different. We invented ourselves. We correlated with the thermodynamic measure. We have an entropy measure, and so many different things.
So you're actually combining several measurements all together to get this map that you're looking for to pinpoint the area of the. Wow, fascinating.
And tomorrow I will show the results.
Excellent. We're looking forward to that. Now, where are the various brain treatment centers?
There are in several places now. The headquarters is in Newport Beach, California, and wherever we set up the clinic, the data will all flow into the headquarters, and then we have an automatic system to analyze it. And currently we have one clinic in Panama City, one in San Diego, and we're about to have one in USC in Los Angeles, and then we have 2 in China, in Taiwan, and
Atlanta, I think you mentioned.
Atlanta is the one that we finish our study, and then we're about to have 2 in New York.
Amazing. It's absolutely incredible. How quickly did you open all these centers? There's quite a few. How long have you been
this whole thing, Brain Treatment Center has business for about 4 years, But I studied this for 30 years, so we prepared this for a long time.
That's rapid growth, though, in 4 years to have opened so
right.
many centers and be
That's
helping
right.
so many families and children.
Absolutely.
Thank you so much
This
for
is such
your
a
work.
pleasure.
Yes.
I mean, your job is wonderful too.
Yeah, I enjoy it very much.
But one thing I want to comment on
Sure.
also, that this is a treatment that we help, if you put an analogy, we help fix the hardware like a computer. But
Sure.
still, we need the software to fill it up.
Oh.
So now we work with, let's see, Joquita, the speech pathologist, and then we found that her unique prompt speech training can significantly improve the kids' behavior by catch up. And then many other behavioral therapy may also be helpful to fill.
So you're almost preparing the brain to accept the information.
That's right.
They can receive that and absorb it,
Absolutely.
and therefore, fascinating. I love it. That's great. I hope
It's just
I
such
hope
a-
a lot of families will look into MRT to see if it's right for their child and their family. Dr. Jin, thank you so much for
It's
your
a
work.
pleasure.
We're looking forward to hearing
Absolutely.
you speak tomorrow.
Great, thank you.
For Autism One, this is Talia Michelle, up close and personal.